Yeah.
You are ready for them.
There is some, yeah. There is some fluctuation that is going on in the Insta.
Your Wi-Fi is working fine?
Yeah, my Wi-Fi is working perfectly fine. But why Insta is coming and going?
एक मिनिट ओपन करूँ इंस्टा. एक प्रॉब्लम है इंस्टाग्राम में फोर्स क्लोज કરીને પાછું ચાલુ કરો.
Okay. I think it's an issue.
ओपन करो. एक प्रॉब्लम કે નથી આવી રહ્યું.
Yeah.
I believe you can wait and start again for a few minutes और પછી ચાલુ કરી દો because
Okay, let us wait for 2-3 minutes while people join. There is some problem with the Instagram connection. Okay, now I think it is more stable, but still it is pulsating.
ભાઈ સર એવું લાગે તો wait for one more minute or else avoid Instagram.
Okay.
So sir, I will disconnect from your over WhatsApp એટલે એકો ના થાય અવાજ.
Okay.
Okay sir.
We will wait for a couple of minutes before we start. Okay. Yes, Keor, it's been an extremely busy schedule over the last couple of months. That's why I have not been able to do these live sessions, and I hope that I will again do them uh, as more regularly as we used to do earlier. So we start with this extremely vital topic of Dr. Akshat. Namaskar. uh, Extremely crucial topic of totality of symptoms. I have been now teaching over the past more than 23 years, and the trend that I see in the modern homeopathy with undergraduates, with postgraduate students, is that of doing the case taking and then directly talking about the remedy that they think of. And in the class, I have asked the students, wherever I have gone to teach, the experience has been universal. So, this is a systemic problem that homeopathy is really suffering from. And with this talk, maybe to an extent, I want to create a dent in that issue. So, when I ask the students, after the case is shown to them or a case history is given to them, tell me what is your totality. And it is very interesting to note that most of them are ready with the remedy, but when I ask them what is the totality, nobody, almost nobody in a class of 50 is really able to tell me clearly what did they see in the case that needs to be addressed. Now imagine a situation where you do not have a portrait of the disease, of the case, to which you have to match the portrait of the remedy. In this situation, what are we really matching? Where is the similimum? Where is the similar remedy? To have similar remedy, we must have a picture, a portrait, a totality of the case, of the disease, of the patient, whatever you would like to call, and then the totality of the remedy. So I do not understand how my young friends are able to come to a remedy without a clear grasp of the totality in their mind, let alone writing it. So, in my understanding, this is a fundamental flaw. And I do not know from where this flaw has really creeped in. Maybe a lot of contemporary teachers do not even talk about the word totality, do not even utter the word totality. It is straight away the case and the remedy. And a large bit of the homeopathic community is influenced by this. And it is a very worrying trait for me. So, coming to the topic today, my first question would be, what is totality? To some of you are watching this, do share your thoughts on Insta or on YouTube. What is it that you understand by totality? Has Hahnemann given us any idea, any guidelines as regards erecting a totality of a case? Yes, do put in your chat box. Let me see some activity. Also, the other trend that I see in the modern day homeopathy is, and you can also see over your social media handles, that videos, material which speaks about materia medica is extremely popular. But when one speaks about the philosophy with the concept of homeopathy, the popularity of that particular video crashes. Without a philosophical understanding, without a conceptual base, the practice to me seems impossible. So, I won't be able to. Yes, so wonderful. Dr. Utsav Prajapati, Dr. Keyur, they have attempted to answer this. So, Dr. Keyur mentions totality of the symptom is constitutes the entirety of the case, the PQRS as well as the common symptoms. And Dr. Utsav says the totality is the altered state of health. Now, this is the two answers are both correct, and both together give the complete picture. So, for those of you who have the organon, Dr. Akshat says totality of the symptoms, most important symptoms of the case, which form the core of the case. Yeah. So, well, Dr. Akshat, I will differ from what you have mentioned as the totality of the case. Dr. Barira, yes, Dr. Barira has been working alongside, and therefore she says it's the altered state of health. So, where is the reference? Where has Hahnemann anywhere mentioned this? So, please open your organons. Uh, After I finish the live, I am going to share with you the PowerPoint slides, and maybe, if possible, we will insert those PowerPoint slides at the appropriate place for your visual reference. But meanwhile, do open your organon, and I will also open my PowerPoint presentation that I have got, which I have created for today's session. Yes, so I want to tell you an anecdote. Recently, I had a year back or a couple of years back, I had attended I had attended the oncology series where Dr. Sarkar, Dr. Sujit Chatterjee were sharing their experiences. And at the end of the session, I happened to speak to Dr. Sarkar, sharing my feedback and experience of the whole series. And both of us actually concurred that the organon is completed in just 3 or 4 aphorisms. The center of the whole of the organon revolves around 3 or 4 aphorisms. What are the 3 or 4 aphorisms? Aphorism number 6, aphorism number 5, aphorism 153, and aphorism number 3. So we have, in this order that I'm talking, aphorism 3, 6, 153, and 5. So let us just go through what aphorism number 6 says. Before we go to aphorism number 6, we must embark and look into the aphorism number 3. And it says what most students would know, that aphorism talks about the knowledge of disease. So, right at the beginning, Hahnemann mentions that if the physician clearly perceives what is to be cured in the disease, remember what he says. If the physician clearly perceives what is to be cured in the diseases, that is to say, in every individual case of disease. Here, the first condition comes that it is the physician's perception to determine what is to be cured in the disease or in every individual case. And this is where things will change, because depending upon what you perceive will be uh, your understanding of what is to be cured in this particular case. So then he further says the first thing is what he perceives to be cured in diseases, that is to say, in every individual case of the disease. Then he says if he clearly perceives what is curative in medicines, that is to say, in every individual medicine, that means the materia medica. And if he knows how to adapt according to clearly defined principles what is to be cured in medicine to what he has discovered to be undoubtedly morbid in the patient. So, what the third part he says, if he knows how to adapt according to clearly defined principles. And this is where the principles mentioned in the organon come. So, three important things. And then he says, he should know in respect to the exact mode of preparation and quantity of it required, and the proper period of repeating the dose. So then he talks of the posology of the medicine, and last, if he finally knows the obstacle to recovery in each case and he is aware how to remove them so that the restoration is permanent. And then the obstacles to the cure is again going to be directly in sync with what you understand the disease is in front of you. So this is aphorism number 3. Right there, as to what you perceive to be cured in this particular case, what you perceive, what is curative in this particular medicine, and then how you can adapt to the clearly defined principles. At each of these 3, the physician's individuality will come. And therefore, it is extremely difficult for the homeopaths to really come to the same remedy in the same case. Because each physician is going to have his own perception of what is to be cured, what the medicine can do, and how he understands the clearly defined principles. Nevertheless, a careful, diligent reading and studying the organon will reduce this variability. Then comes the next part. Once this is determined, then he says in aphorism number 6, the unprejudiced observer, well aware of the futility of transcendental speculations, can receive no confirmation from experience, be his powers of penetration ever so great, takes note of nothing in every individual disease except the changes in the health of the body and of the mind, which can be perceived externally by means of senses. That is to say, he notices only the deviation from the former healthy state of the now diseased individual. This is which are then the rest of the aphorism follows. This is probably the only aphorism where Hahnemann is so categorically mentioning, see the words that he uses. Be his powers of penetration ever so great, takes note of nothing in every individual disease except the changes in the health of the body and of the mind, which can be perceived externally by means of the senses. He says, keep everything aside, become like Arjun, just see the eye of the bird. What has deviated? So he says he notices only the deviation from the former healthy state of the now diseased individual, which are felt by the patient himself, remarked by those around him, and observed by the physician. All these perceptible signs together represent the disease in the whole extent, and together they form the true and only conceivable portrait of the disease. So you will have to freeze this aphorism, stick it on your desktop, and follow it absolutely exactly what it is mentioned. When I ask firstly in the class, what does aphorism number 6 tell us about? Most of my students will answer it is talking about unprejudiced observer. And as you read this aphorism number 6, he really doesn't talk about unprejudiced observer at all. He says that the observer needs to be unprejudiced. What he really talks about is what constitutes the portrait of the disease, or what we call the totality. And have a look. If you have the organon with you, you can read and see he takes note of nothing in every individual disease except the changes in the health of the body and of the mind. This is where the holism comes. He says just not the bodily changes, but also the mental changes. The whole organism experience a shift. So, for example, today morning, when I was doing the case, my patient of ankylosing spondylitis, and he says that since this disease has taken shape, I have become extremely anxious of the future. I have become completely hopeless that this disease is going to get better in any way. So, not only were his changes at the physical level that were important, but the change in the state of mind together, both these things will constitute the totality. So, in my case taking, my favorite question is, tell me what other changes have you noticed in yourself since this disease has appeared? Please note this question. A case of diabetes which started 15 years ago, and my altered state in this situation is to be considered since last 15 years. If it is an acute disease, then you will have to figure out what has changed since the beginning of the disease, the acute disease, which would very well include the prodrome. What changes have you experienced? So you will have to really ponder over this aphorism number 6, the most overlooked aphorism of the organon. In fact, the organon itself is overlooked, but even those who have paid any attention to the organon have overlooked this aphorism in a very big way. Okay. Then we come to aphorism number 153. The 153 aphorism, Hahnemann discusses what we call as the characteristic symptoms. And he says, in search for a homeopathic remedy, that is to say, in this comparison of collective symptoms of natural disease with the list of symptoms of known medicine, in order to find among them the similar remedy, the more striking, singular, uncommon, peculiar, characteristic signs and symptoms of the disease are chiefly and most solely to be kept in view. For it is more particularly these that very similar ones in the list of symptoms of the selected medicine must correspond to in order to constitute it the most suitable for effecting the cure. And in the same aphorism, he also tells us what is to be left out. And he says the general and undefined symptoms like loss of appetite, headache, debility, restless sleep, discomfort, and so forth demand but little attention when they are of vague and indefinite character. If they cannot be more accurately described, as symptoms of general nature are observed in every symptom, every disease, and from almost every drug. And this is the sequence in which he writes in the text. Why is it that he doesn't write 153 first? So somebody just now mentioned that totality of the symptoms is just the most important symptoms of the case which form the core of the case. The core of the case, 6, Dr. Barira, aphorism number 6. The core of the case is a very variable factor. It depends on what you perceive at that point in time to be cured in that particular case. The general guideline is the altered state of health. So, and then the last aphorism, which is the most important but the most trickiest aphorism, is the aphorism number 5. And he says, useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of an acute disease, as also the most significant points in the whole history of the chronic case to enable him to discover its fundamental cause. Says, in an acute disease, the exciting cause is what one will look for, and in the chronic case, you will have to go through the significant points in the whole history to find the fundamental cause. And then he adds that the fundamental cause usually is a chronic miasm. And then he goes on to say, in these investigations of the fundamental cause, you will have to look into the moral, the intellectual character, the occupation, the living, the habits, social, domestic relationships, his age, sexual function, etc. So, this is the steps that one will need to actually execute in the case. Do your case taking, look for what is the altered state. The altered state, as we found in aphorism number 6, is everything that is altered in the state of mind and in the state of body. This constitutes the totality. From this, you pull out what is characteristic according to according to your understanding. And then identify if you can find a fundamental cause if the disease is chronic, and an exciting cause if the disease is acute. Put them all these together. So the altered state plus the fundamental cause or the precipitating cause together will constitute the totality. And from that, you pick up the characteristic, which is most important in individualizing the case. So these are the fundamental philosophical concepts, and I will share in brief a couple of or 3 or 4 of cases very, very quickly, because we will not have too much time. So this is a case of a woman suffering from asthma and claustrophobia. She says, I get this dry cough and I retch with the cough, and this cough is better walking. This is very interesting. This cough is better walking, and it is worse when I am on the stage or I am in the midst of people. And then there are other modalities which are quite commonly seen in a case of an allergic asthma, like aggravation lying down, aggravation perfumes, aggravation dust. And because of this asthmatic attack, she's sleepy, but she's unable to sleep. And then she says, I cannot sleep. I feel in closed spaces like theaters and aircrafts, I am extremely suffocated and I am unable to sleep in those situations. And she says, generally, and more so during the acute attack of asthma, she cannot tolerate darkness. She must have light. Hmm? She says, I cannot sit in the theater. I have to get out of that closed space. I cannot even sit in air conditioned cars and aircrafts. She's constipated, and I found that her basic nature, what we call, what Harriman talks in aphorism number 5, where you look at the patient's moral, intellectual character, the modes of living, to find the fundamental cause of a chronic disease. Please note this. Therefore, we are doing the whole history, the whole life space examination, because we want to discover the fundamental cause of the disease, because we know that in asthma, the personality of the patient has direct implications on the as a causative factor in asthma. This is coming from aphorism number 3, our knowledge of disease, what I perceive as a physician about the disease and what is to be cured. And therefore, the whole history is taken. We never question, no, why we want to take whole history. So I found that she's very anxious about her health. She's very anxious when she's alone. She's very timid. And I could never take risk in childhood, she says, even now also. And she's very anxious when her kids do not bond together well, and she will seek security in her family. Least bad news that she will receive about anybody, and she is extremely anxious. As a child, she's an extremely obedient child, very diligent in her work, and she would really score very well, and she would be like the example for the rest of the class. Now, if we look at the aphorism number 6, aphorism 153, aphorism number 5. So if we look at the altered state, and then we look at what is peculiar in the altered state, we will find that this cough is better by movement and it is worse on a stage. And what are the concomitants that have happened? What is the change in the state of mind? She gets anxious, especially if it is dark and especially in closed rooms. And as a basic disposition of the individual, we have already discussed that she's very risk averse, very timid. She's anxious in a new situation, new place. She cannot tolerate stage and crowd. Very anxious then. Now imagine if I did not consider this meticulously, the altered state, I would have completely missed out this characteristic symptom of better by movement. And I would have just considered her basic nature, which is very timid, risk averse, anxious into new things, cannot face crowds. And I might have given her something like Calcarea silicata or something like that. But when I put this in the therapeutic pocketbook, some very interesting remedy comes up. The rubrics that I put is better by movement, aggravation in the room, she is very anxious and fearful, aggravation, darkness, and better in light. And the remedy, calcarea carb, is completely ruled out because calcarea has aggravation from light, whereas our patient has got better in light. And then the next remedy to calcarea with the therapeutic pocketbook shows is strontium carbonicum. This is very interesting. Strontium carb also better by movement 2 marks. Aggravation in the room 2 marks. And we know strontium is just below calcium, extremely anxious remedy, having stage fright like argentum because it belongs to the same row as argentum. Also anxiety about new things. And this is the remedy that emerged as a remedy of choice. And I gave her strontium carbonicum, 1 m, quite infrequently. It's almost a year or so now. And she would need to take these inhalers, aerosols, bronchodilators. She has not had a single episode where she required any of these. In fact, she went on a trek over the hills and she was very apprehensive that I might land up with an asthma attack, and nothing happened to her. She didn't even require the remedy at that time. So this very finer difference, or just a little shade difference. This is the first case that I want to share. I want to share another case. It is also a case of asthma. And this is a young little girl when she came to me, and she gets extremely severe asthmatic attacks. She's 5 years old, so severe that she required ICU admission more than once. She says the mother reports that when she talks, her asthma gets worse. It is worse with change of weather. It is better by fanning. I'm telling you only the most peculiar part of the case. And she says she will not let the mother go when she has an acute attack. She must be in the mother lap. And if the mother goes to even have food, she will scream at her mother. She will not even let her mother sleep. The mother has to be awake all night and keep rocking her or taking care of her, fulfilling all her demands during the acute attack. See what I mentioned, changes in the state of the mind and in the state of the body. Both. And during the whole case taking, the mother reports that she is extremely stubborn. And the only thing that she will eat is chocolates and ice creams. She will demand to have fruity, those drinks. When she is very ill, and even if her cousin is having it, she must have it regardless of her being ill. She doesn't like wholesome food, and most of the time she's screaming and shouting because she has to have her demands fulfilled. She's extremely angry kind, and she's always in competition with her cousin. And when I'm talking to her, she doesn't even want to look at me. Forget about listening to my questions, doesn't want to even look at me. And the mother says that he will do anything for you if you give her chocolates. And now that she's 5 year old, she insists that I am not going to walk. You have to lift me up, regardless of whether you are tired, whether you have a shoulder pain, whatever happens, you have to lift me up. Otherwise, there is a big tantrum on the road. She will scream looking at ants and she will kill them also. And let alone the mother, but the neighboring child with whom she wants to play, she will vent out all her frustration on that little boy. She will pull his hair, hit him badly, push him, and then she will complain that this boy is dirty. But she will want to play with him. And the mother says that she's very dictatorial. She's like the boss in the team at school, in the classmate, with the classmates. She will throw out a classmate from her team if that child doesn't pay attention to her instructions. And she's always complaining about her classmates. This is a little bit in brief. She cannot tolerate heat. Like I already told you, the cravings and aversions. And with this situation, I gave her the remedy gallic acid, to which she showed good improvement. But what happened after a couple of months of gallic acid? That in the follow up, there was a huge attack uh, uh, after around almost a year, and she again had to be put into ICU because her SpO2 dropped down to less than 70. So I reviewed the case. I still found the same history. Nothing much has changed. The remedy was well selected, but still there was a big relapse in the condition. So at this stage, I looked and found some additional history. And I found that uh, the mother had asthma, pneumonia, and maternal uncle also had asthma and pneumonia, and maternal great grandfather had tuberculosis and COPD, and mother's uncle also had coughs, and maternal grandfather. So the whole maternal side had severe allergic rhinitis. So at this stage, my totality was re-evaluated exactly according to aphorism 6, aphorism 153, and aphorism 5. What is peculiar in this condition is her lack of reaction. Well selected remedy also relapses. This is then the peculiar part of the case. We know the active miasm of the case. See what we said? The fundamental cause usually is a chronic miasm. The active miasm is tuberculosis, and here we have very significant history of tuberculosis in the family and if the tubercular miasm in the family. And we have this very dangerous hypersensitivity reaction that we know is very classical of tubercular miasm. And then you look at the basic disposition, which also represents the tubercular miasm. And the remedy that selected was tuberculinum. And after giving the dose of tuberculinum, the next episode of asthma that she developed, she responded to the same gallic acid that we had given earlier, and she had stopped responding. So you see that the idea of what is to be treated in the individual case, aphorism number 3, plays a very crucial role. At this stage in the case, this was the twist. You have to appreciate that there is a lack of reaction in the case, and one will have to appreciate that not all the time you are going to doubt your remedy and keep changing the remedy in making the same totality. The problem with us is most of the time same totality and some another remedy is found. Here, the first time, aphorism 5 was not given that much importance because it was not so dominating. Her disposition was so strong and dominating. But after this almost 10 months, 11 months, when this big relapse happened, I thought we will have to change the whole remedy. Again, in my history taking, if I would have not looked into the family history, which I had missed earlier, because I had not understood aphorism 5 then so well, then nor had I understood the Hahnemanian understanding and application of the concept of Maya. So the totality changed and the remedy therefore changed. And then the response changed. That reaction to her was handled. And then the same remedy which failed began to take through the whole case. I have a follow-up of this case for almost 5 years. And at the end, the mother says that she has become such a wonderful child. Her temperament is completely calmed down. And she's doing very well at school. So this is the importance of really applying the principles of the organon exactly to the T without any need to improvise. Most cases, one will not really need to do too much improvisation of what Hahnemann has already discovered for us. Let us follow this, and then in cases where things don't work, let us improvise. So the new also has its space, it has its niche, but it does not replace what is already discovered and proven for more than 200 years by all the past masters. So this is what I had to share today for this very important topic on totality of symptoms. Any questions please feel free to ask. We have 2 more minutes, and I will be more than happy to answer to the best of my ability. Dr. Keur comments that this sounds like a standard operating procedure. Yes, this is a standard operating procedure. Take the case, explore what is altered in the case at the level of the body, at the level of the mind, generals, whatever levels you can understand. Then go pick the characteristic, check what is there in terms of the causation of the case, erect a totality which consists of the common as well as characteristic, keep the characteristic in the center, and then find the remedy. I can tell you for sure, more than 8 out of 10 cases, you will be able to just sort them out just following this absolutely as a discipline. Don't ever try to do the case and directly talk about the remedy. Pause a little, take down time to write the totality. This writing totality is very important because it clearly gives a lot of clarity of your thoughts. I understand that most of my young friends are very impatient to get to the remedy and get the patient better. But our human mind and human perception has not really evolved to the pace of the social media and the YouTube reels that we are constantly exposed to. Take a pause. We will have to learn to take a pause and put down what is the totality in every case and at every stage of the case. Okay, so I believe no questions are coming. We will put this video on my YouTube channel. Do subscribe to this channel. Even those who are on Instagram, we have a channel on Instagram. Do subscribe to the Instagram. Lots of interesting information will be put through, and also upcoming webinars you will be informed about. I recently finished a webinar on diabetes and how to manage diabetes. We are a repeat relay very soon, and we will inform you about that. So take care, pause a little, learn to pause, learn to just contemplate, learn to just think instead of just flipping over and scrolling the information. So goodbye and see you soon. Another live video. Bye bye. Take care.